Medical outcasts. Access denied. Voices of undocumented Zimbabwean and Mexican women fighting gendered and institutionalized xenophobia in American and South African emergency healthcare. As witnessed through the first-hand experiences of a frontline activist and international aid worker, this research gives voice to the outrage of inequities and inhumanities in undocumented women's emergency healthcare access. A culmination of my personal medical aid work and one-on-one interviews with undocumented Mexican women in the USA and Zimbabwean women in South Africa, this documentary of women's suffering is the direct consequence of today's current xenophobic public policies, coupled with a tragic failure to enforce healthcare access rights. Through my 13 years as a social justice activist for poor and oppressed women, I am honored to be a crowned Queen Mother in Ghana and have witnessed firsthand how the innate bonds of sister and motherhood can erase man-made boundaries or hegemonies. It was my life in Houston and my travels to Johannesburg on medical outreaches that allowed me to draw parallels between the immigration influxes and healthcare crises between the two burgeoning urban migrant megacenters of Houston and Johannesburg. This fateful epiphany was to serve as the catalyst for 6 years of research that would inextricably tie the Third World to my world. It was in these two cities that I witnessed a forced migrant's worth reduced to political hot potatoes, uninvited and unwanted liabilities to be hastily juggled from one government agency, hospital, or NGO's hand to another, with no one truly hoping for any lasting ownership. It is these discriminatory policies that allowed Fungai to lose her first baby after 6 hours complaining of fever, vomiting, and back pain at a local Johannesburg hospital. The head nurse had shouted at her, "You are a Zimbabwean. You must go back. We are sick and tired of Zimbabweans here. We've been attending Zimbabweans all day." And it is these discriminatory policies that led Elena to wait over 8 hours at an emergency room, only to miscarry as she lingered among the dozens of other indigent patients in one of Houston's overcrowded public hospital emergency rooms. It is Fungai, Elena, and many more who speak for undocumented women that report being denied emergency care, charged illegal fees, and mocked by callous healthcare staffers. This research seeks to give a voice to these women. 24 women's patient experiences were evaluated based on the following factors: their role as active or passive decision makers, purpose and barriers in seeking treatment, provider response, and quality of care. The research showed that the interviewed Zimbabwean women in Johannesburg sought out emergency care 16 times more than their Mexican counterparts in Houston, even though their stay in the U.S. was 8 times longer. The majority of the women fell within childbearing ages, so the use of obstetrical care was not unexpected, with half utilizing obstetrical and gynecological services. Significant differences in the acuity and infectious nature of reported diseases were also noted. Infectious disease was reported by 21% of Zimbabweans, as opposed to only 10% of Mexican females, whereas 50% of Mexicans sought care for lower acuity illnesses such as diarrhea, flu, and migraines, compared to only 21% of the Zimbabweans. But perhaps the most surprising finding was the high number of Mexican women, some 60%, who cited depression as one of their indications for seeking care, yet remained unreported by a single Zimbabwean. From a fiscal and public health care perspective, the distinction between higher cost, long-term, and infectious diseases versus minor illnesses cannot be disregarded. Working in state-sponsored organizations and NGOs as providers and activists, we fear that the very survival of our services is contingent upon openly challenging any institutionalized xenophobic and gendered policies of the state. If left unchallenged, gender inequities within the ideologies of emergency preparedness planners, politicians, and healthcare institutions will continue to result in gender discrimination, gender-based structural violence, and inadequate and/or inequitable emergency healthcare access. As activists, medical aid workers, and researchers, we can draw not only an intangible line, but rather a palpable correlation between a state's systematic and systemic denial of emergency healthcare to a structural violation of human rights. In the end, if we are to effectively engage in the struggle for social justice and human rights, we must proactively meet the emergency healthcare needs of undocumented women by closing political loopholes, eradicating prejudicial healthcare policies, and enforcing regulations that will change today's theoretical rights into tomorrow's tangible practices.